Hey guys, I'm out here East Meadow with Dr. Jim. I just want to give you a little behind the scenes of what we're doing here in our PT sessions. Started working with Dr. Jim last week. We're 13 weeks out from the RL now. So we're sitting at 12 weeks out now. Pretty much came here just to, not because anything's really bothering me or I'm injured, but just want to get more generally prepared for like the type of weights I'm going to handle in training and make sure I can handle these weights safely and effectively. So that's why I'm here with Dr. Jim. He's the man to get the job done, and wanted to bring you behind the scenes.
Yeah, so let's start going through a little bit of an assessment. So we're going to start head to toe. So face my direction here. First thing you're going to do is look up towards the sky as high as you can. Good, and then look forward. You're going to keep your mouth closed, try to touch your chin down to your chest. Good, look forward. You're going to look over your left shoulder, try to touch your chin down to your collarbone. Good. Look over your right shoulder and try to touch your chin down to your collarbone. Good. Face in this direction. You can face your whole body this way. Try to touch opposite shoulder blade. Then you're going to reach behind your back as far as you can. So pick an arm and touch. Good. Good. And when he's doing that, so reach that left side again. You know, he's got a lot of extra upper track movement there. Let's do the same on the other side. The same thing. Plus he's shaking and there's a lot of effort. Now reach behind your back. So the goal to see is, can you reach up to the other part of his shoulder blade here?
Last week it was down to hand.
And then the other direction. The same thing. The goal is, can we reach over here? And the one thing I notice here is he moves well down here, but for lack of better terms, this whole area here is kind of just glued. Just all the way glued in. You know, all across this superior border, things are tight. You know, he's got a big bench and holds big loads, but just at rest, the muscle tension shouldn't be so much. You know, it's very similar over on this side, and that was an area we found last week to be part of it. So the question is it a muscular problem in here? Is this stuff holding too tight? Is there some weakness throughout here? Or is it just a lack of motion, which could even go into his ribs and things that way? So now turn to the side facing me again, feet together. So just kind of to finish out the rest of the body, let's bend over and try to touch your toes. So we're looking at whole body flexion, and stay down there for a second. So first he doesn't get there. He does a good job weight shifting. He's a little flat here, you know, and even, you know, he's rounded nice here, but maybe that extends a little too much. So we're just looking at whole body flexion, and then we got to break that down further to why, and then come up. Try one leg at a time. So put one foot up, and then see if you can get down to your right side, and then switch to the other side. When you put your foot up, you can put it like right your instep, just like that. So we know it's not a unilateral thing. It's not single. So now, facing the same way, feet together, reach your hands up over the sky, and bend backwards as far as you can. So the one thing I'm looking for, does he have a uniform spine? Does he actually shift his weight forward, which is something he doesn't do, and then come back forward? Just also the quality of where he's getting red in the face while he's doing it. There's a lot of effort with bending. So then now, just to see if upper body's, you know, a part of that or not a part of it, put your hands on your hips. So we're going to eliminate his arms, because his upper body, his chest, his shoulders are definitely part of movement dysfunction. Try to bend backwards now. Feet together, yeah. Good, and then relax. Do that one more time, and in a second here, let me just grab something. So if I was to put something like this, kind of near the front of his hips, bend backwards again, he doesn't move his hips at all. So if we're looking at total body extension, he's extending, you know, well through here. He's moving well through his ribs, lifting up through his ribs, but he's not actually extending through his hips at all, which could be robbing him a little bit of power off of leg drive as well. So we'll look at one last thing. We're going to look at your single leg balance. So you're just going to lift one leg up, thigh parallel to the ground, and then you're going to close your eyes. And where this becomes important is just sensory information for your pelvis. When you lift one leg up in the air and you balance on one leg, now granted you're not balancing on one leg when you're benching, but when you're lifting one leg in the air, there's something going on with your pelvis. Positioning wise, lack of awareness, weakness, something that will figure out. Some of it seems like you're not moving it as much, or there's a disconnect between your brain and where your hips are. So that's something we've got to tease out and kind of figure what the issue is. If you turn and face this way, there could be, with stuff being tight up here and these muscles kind of working in these diagonals, there could be something here that's being affected down here. You know, like when you go to bend, you know, your lower back muscles tightening up more instead of rounding and bending, which for a deadlift is fine, but just for normal body flexion, we want them to be able to relax. So there could be like a power leak between those two. You know, something's tight up here, you know, you may not get a chance to be able to use everything down there. And that you know, bench press is in one position. So it's not like you're throwing a ball or you know, you're swinging a bat or anything. But yeah, but if that's part of normal motion, side bending, rotation, you know, full flexion, full extension, we got to figure out where that missing point is. So, you know, the first area is just to figure out what's going on up here. So the first thing we're going to do is we tested you in standing, where you're putting your arm behind, right? So let's test it lying down. So just take one arm and try to reach behind and touch your opposite shoulder blade. Good. And then rest. So I'm going to do that with you, right? So then now passively, if I do that, is it easier to get there or still tough?
Much easier.
So it's a little easier. So me getting your shoulder blade back helps you. Okay, so now go to the other side. And then relax. Is that easier?
Yeah.
Okay. So then now reach behind your back. Same thing, reach up as high as you can. Good, then relax. And then I'm gonna bring you there. Is that easier?
Yeah.
Okay. Still very tight though.
Yeah.
Same thing, reach behind your back there.
This is a lot harder here.
Yeah. So with this being so much harder in standing, because this is against gravity right now, there's probably a strength issue or a stability issue. I'll use the word strength as like a general word, but a stability issue where under this load of gravity, something is not holding your shoulder blade up. So if I play that role, is that easier?
Yeah.
Yeah, so if I lift the whole system up, it moves. So, I mean, we think about what's funny about this, right? So you bench how much?
710 my best.
Yeah, and you can't even lift your arm against gravity. So there's like a high chance that dysfunction could cause an issue. Like there's very little cause and effect on those things, but it's 100% stealing some kind of stability, maybe strength from you, maybe coordination. So, you know, that it's hard for me to say 100% because there's no direct line correlation between that. You know, because when you get under the bar, you just might have that coordination and just hit that groove and you're good.
Yeah.
But if this could move better, you definitely have the ability to have more range of motion. So if we were to look at what that motion of reaching behind your back is, that's internal rotation. So it's really three things. It's shoulder extension, it's elbow bending, and then it's actual like internal rotation, right? So what you're gonna do first with your arm straight, just lift your arm up as high as you can. So in a normal world, we're looking for like 50 degrees, right? I mean, he's barely breaking the plane of his body, just with his own force. Relax, I've got your arm. Plus there's a lot of effort to do that. You know, you got big arms, but they're not 700-pound arms, you know? So it's like it shouldn't be that much effort to hold your own
I got
your own body weight.
of a big man.
So if I try to bring him up into extension, like it just doesn't want to go. Like that's it. You know, so if we think, you know, here's 90 degrees and I want to get at least to half of that, you know, maybe slightly past, I'd have to get his arm up to there and it's just not going. So some of that limitation could be because he doesn't have that extension. That extension could be maybe tissue tightness around here. It could be some pec tightness if you just train that you know, sometimes I look at dysfunctions and then go, oh shit, you just benched yesterday, that's why you're so stiff. Or it's hard for me to get under a squat bar without getting super wide, that like I'm gonna have like stiffness up here just from that stretch, so the next day's gonna be tight. Or if you just had, you know, an accessory day and you're getting a bunch of blood flow in there, you know, you're just gonna be tighter. So part of that would be is actually looking at the tissues to see why. So we know this is limited, but is it ball and socket limited? Is it shoulder blade, rib cage limited? Like that's better when I get your shoulder blade there. So if I get in here and I get your shoulder blade, all of a sudden your extension's better. So that could be because of the positioning there. And there could be some tightness there. So we want to figure out why. So now if you go here, can you just touch your thumb to your shoulder? Good, and then down. And sometimes someone can't do that because their guns are too big, like in my case. I definitely can't. I definitely can't get there.
Wish I had that.
But I just want to show you this, just for all seriousness. I can't physically get there because it's
Just the meat on meat.
it's too much mass.
Yeah.
It's called soft tissue approximation, just too much mass, right? So in your case, that's definitely not a problem. So we know your elbow's not an issue.
Yeah.
Even if you have some elbow issues just from pain and things like that, we know physical limitation, it's not there. So now if we look, internal rotation, arm in this position, so I'm gonna have you hold your arm there. You're just gonna rotate your arm backwards. So you can start literally whenever you want. So he has virtually zero internal rotation, right? So if I support you, now do it. So you need some support. If I get you there and then I bring you, you know, you have motion. Now maybe I gave away your shoulder blade a little bit, but you have motion. So when you don't have that motion under your own control, the good news is it's a strength issue. And that's something you can always get stronger. You never want it to be where you move there and then I try to move you there and it doesn't move there. This goes off the first thing I mentioned to you about you being like very mobile and just not knowing how to use it. Like that's kind of proof. So when I put you in the right spot and all of a sudden your motion's better, right there, you just got to learn how to use it again. Pop over to the other side. Let's do the same thing over there. So first thing will be arm down to your side. Here, lift it up in the air as high as you can. Start whenever you want. So it's, you know, same thing. If I go to help, so relax. If I've got the weight of it, so it's truly passive, I can get you further. If I get your shoulder blade up, I can get you all the range. So imagine if you were here, and then that's where your press was.
Yeah.
You know, it's. I mean, we're talking from a performance standpoint, getting that kind of motion and being there. Like, I mean, we're talking inches of bar movement, which, by the way, could be huge. Think of how many people get buried on their chest, and if I can give them who could have used 2 or 3 more inches?
Yeah.
You know what I mean? Like for everywhere, kind of idea, right?
Yeah.
So now let's see this motion here. Hold it there, and then rotate it backwards again. So you know, same thing. A little better than the other side, but if I unweight you, like you have good motion. Even if I hold your shoulder blade so there's no extra accessory, like you have very good motion there. Try to hold it there. Yeah, so you know, sometimes I'll have people move, come like straight down the line. Move that way as much as you can, so we can see that motion. If I take the weight off, now move, it's better. And then I take completely the weight off. Now it's like full motion. Now hold it there. Good, keep that tight. Hold it there. So that's how you. I know it's a strength issue and how much effort you're putting in, literally just to hold your arm up. And now relax. Hold your arm there and test that range again. See if it improved. Maybe it's slightly better. You know, it's one of the things to where all this is proving is that we need some kind of strength there. So some of that strength, that's into internal rotation. So I'm not saying that a standard kind of internal rotation motion is good or bad, but it might be something we look into. You know, it might be something that we can actually put force into and build strength there, or we lay down with a kettlebell and you start learning some strength and control throughout your range of motion. kind of loaded down in a similar position,
Like I
which
said,
is probably more likely what we need to do.
Like any extra range of motion benching, like I mentioned, the duffel bar just can't do.
Yeah.
Just puts a lot of strain.
This area right here, when it's overactive, it's going to pull up on your shoulder blade. So if we're in a bench press position here, and you're here, and you're getting to load, and that thing goes up this way, you're dead. It's over, right? And in your case, you might die because that bar's going to fall on you. Seriously.
Yeah.
I've rolled weight because I false grip. I've rolled weight off with a different bar, like onto my chest. Like that's a real bad place to be. And how many people, as you go to start, your shoulder gets real angry because it's not loose. And if that shoulder blade can get there, all of a sudden you got all this range in the world. And then if that's tight, then you could explode off of it. So some of that is part upper trap. And if we follow that shoulder blade right to that corner, it's right into where your levator scap is, which is pretty responsible for when there's limitations to shoulder blade motion. So basically, if we look at your shoulder complex, and we look at it as 4 joints, we got ball and socket, we got your AC joint, follow all the way over to your SC joint, and then your shoulder blade on your rib cage. So if this is limited, and then we already put a lot of stress on the AC joint anyway, and it's really just a simple joint like that with a capsule around it with a little bit of movement.
Yeah.
Then over here, same thing. You just got a bone kind of sitting in a groove. There's not a ton of motion there, but this is the only bone-to-bone connection with your shoulder complex and your ribs. This is all muscle back here, and this is kind of floating out and is just connected via muscle and ligaments, to where this is where people try to attack a lot, like let me loosen in here, do all this stuff. But if you can move this better and you gain this control, a lot of times these range of motions go away. And in your case, when I put you in a better position and got your shoulder blade in a better position, you were able to move your shoulder more.
Yeah.
So if we don't loosen that up and address what your actual limitation is, then I'm throwing shit at you basically. And by the way, you're probably going to have, stiffness and tightness around there, but it's not the reason why you have a dysfunction.
Yeah. Well, that's always a common misconception, right?
Yeah,
There's
well,
attack what's like.
yeah, well, part of it is, I don't know, like some of that stuff unfortunately is trial and error, right? So, hey, when I do soft tissue in here, it feels better. When I do soft tissue here, if I smash tissues, it feels better. Which I'm not against something feeling better. If you got tons of time, do it. But if you're trying to get more out of performance, I always equate the body to like bringing a car into the mechanic. If you bring the car into the mechanic for a specific noise, it needs to be addressed.
Yeah.
Like they're not just gonna say, "Oh, here's your car back," and that ticking noise is still there. But you know what? We put new fluids in there, and you got new wipers, and it's like, well, that's not why I brought it, right? So in your case, where you don't have actual pain, and we're looking for what could get the most out of your performance, we have to say, okay, well, it's like fine-tuning a motor. Okay, this motor runs fine, and in your case, maybe it's actually not running fine. There's some other things going on, some of which is connected, because better movement here could allow for better movement down here. Some pelvic positioning here could literally be because you're just not using it. Yours powerlifting is in one motion all the time. So if it's in one motion, you're not, unless you're out playing in softball leagues and running around and stuff, and you probably had to stop a lot of those things because of powerlifting,
Baseball was
right?
tough, just couldn't move around.
Yeah. So some of it is, are we supply and demand? Are we supplying our body with whatever needed for the demands that we put on there? So with powerlifting, do you have full mobility and control through all of your mobility? So just standing against gravity, you're limited.
Yeah.
And part of that is, this area here, like this glides and moves well. And when I start to get up into there, that's where the problem ensues. Like just that upper part of your shoulder blade, and that medial border, I find that it ends up being the thing that limits most overhead shoulder motion, most bench press style motion. Whether you're a golfer or a baseball player or an overhead athlete, anybody that's pressing overhead, I've got a lot of people that compete in CrossFit that, you know, like they always have some kind of overhead movement into one of their complexes.
Yeah.
Whether it's from pulling or pushing, and if you don't have control just in regular standing against gravity, then when you load it, now you're loading a dysfunction, which is fine, but it's going to break down at one point. So depending upon how you're going to take care of it becomes a part of the issue. So I'm just going to keep a little pressure in here as I move you. And all I want you to do, try to push your arm down to your side. Good, and then relax. Do that again. Push.
A lot of force.
Just meet my force. Yeah. All I'm looking to do is when I have part of a muscle like under some kind of pressure, theoretically maybe I'm shortening that muscle, or if there's a tight spot or tender point or trigger point, whatever you want to classify it as. When I get into something like that, if I could get other parts of your muscles engaged, that'll relax, and then just allow for more movement. So try to push down again, and then completely relax. So then all of a sudden I got all this movement every way. So then now in the extension I could bring your arm kind of just way back here. There is, as much as I talk about the shoulder blade, there is something going on there. Like just when I get to, there's certain end feels when you pull on something, you feel something, yeah, and that's more into tissue. And that's where typically this is an upfront issue. Just if this is tight, it's going to restrict. But it's almost like that needs to move there, and then all of a sudden you got that extra range.
Yep.
So I see that a lot of times, almost posterior capsule, posterior delt. I'm less concerned about the specific actual tissue, whether it's the name or the fibers, and more just the quality of stuff. Like for example, when I reach through there, that feels way different than that. Like that's just a little stiffer and tighter, and you press into enough of those and you go, that doesn't feel right. So what we're gonna do is while I have you here, you're gonna try to pull your arm forward. Good, and then relax. Pull forward. Good. So it's almost some kind of active release style techniques where you're actively using your muscles while we keep some pressure there. So pull forward. Good. So then all of a sudden now you got all the extension you need. So if we're in that extended position, now your hand's deeper than your chest. So the cool part about most of this is you could do by yourself. So getting a ball back here, whether it's a lacrosse ball or some other kind of soft tissue ball against the wall. This area here I like against the wall instead of in weight bearing, kind of where you're laying down and smashing your tissues, because it's a lot of pressure. And if you just smush something into oblivion, your body's just going to tighten up. So if the goal is to loosen up, you just made it a longer path.
Yeah, what we were doing with the ball there, that seems like just perfect pressure.
Yeah, and some of it is like, what do you need to get it done? And then just give that. So if you need a lot of pressure, give it a lot of pressure. Leg muscles are big, thick, and dense. Like they could probably take a lot more pressure than these little guys up here. And some of it is a little bit of a trial and error. And then, by the way, pressure is also very relative to, like for example, I could dig in here because it's big old tight. If I come through your forearm, like that's way less pressure, and that probably hurts way more.
Yeah.
Because it's smaller, it's more pinpoint, smaller fibers. So when you're given your own pressure, it's very relative to your tolerance to it. I've got some areas like an outside thigh and upper in here that are just super tender. You put a little bit of pressure there.
Oh yeah, for here, someone hand rolls me, that's about it.
Well, part of it too is if we're diagnosing what's actually going on, right? So are these tight fibers? So is it just increased muscle tone? So increased muscle is like you flex your bicep, that's increased muscle tone. So if I'm smushing against a flexed bicep, that's a totally different story. If that's a trigger point, actually fibers that trigger symptoms to go other places, or a tender, an active one, or a tender point, or a latent trigger point, like it's treated different. Like an actual trigger point, if you believe that they happen, Yeah, they only need like 4 to 6 pounds of pressure. 4 to 6 pounds of pressure is the same amount of pressure that you change like your fingertips white.
Yeah.
So in here, we find like a trigger point, and we go, okay, well that actually addresses a trigger point, not elbows and digging, right? Sometimes that's done because someone doesn't know any better, or because it worked with somebody, or you get a big power lifter in and go, I'm just going to beat you to fucking oblivion because that's what I seen on Instagram, or that's what helps the person, or that's what the person requests.
Yeah.
So my viewpoint is, if we find the right issue and we diagnose it correctly, and some of that's trial and error, but if we diagnose it correctly and then give it the right thing, then it should make you better, not worse. Then the other part is you should be able to leave here and go bench. You shouldn't be recovering from some soft tissue session. First, if it's breaking down your skin, if we're doing some grass and stuff, or if it's so aggressive that you can't move. There is one idea with that we create a new healing environment so then your body heals. The other part is that's not what high performance athletes do. Because if you have to train every single day in some facet and you have to recover, or you can't train because I beat you up, that's the wrong thing at the wrong time. Now, if you're in the off season, I can make arguments that, yeah, I'll beat the shit out of you and make you better, right? But sometimes that's done because people don't know any better. They're young therapists, they have no experience, they
Well, a lot of times people just say beat the shit out of me because, they don't know better either. They don't feel like they're getting enough pressure. They don't understand that you don't need as much.
Well, if you're in the right areas, some of it is, and whenever I encounter, when I was a younger therapist, I thought I knew everything. And until I went to some classes and I realized that I know shit. Then when people would come in and they'd come in with something I had never seen before, I'd fake like I knew what was going on. And one of the best things I ever did was say, like, I don't know. I don't actually know. Like, I haven't seen this. So then every time something new comes in, like I had a different hip surgery approach, it gives me a chance to review some of that stuff, which is awesome. So I've been seeing a lot of these things, so I start reviewing, okay, where's the actual attachments? So it's like everybody, when they work on this, cranks on people's necks. Well, your neck's stiff. If I crank on your neck, I think I create a bigger problem. If I can get you in a comfortable position here, get you on your side and start to get into here, and then say, okay, what do I need to get into there? Well, on this side, I need to get here and then try to push your shoulder forward. So where my hand is here, push forward and then relax. So that allows me to actually get there. Now I can move there. So push again and then relax. What was different on the other side is the other side was more upper track. Here, it's more that border. Now all of a sudden that right there, now look how loose your shoulder is.
Yeah.
So we didn't have to go bonkers. I didn't have to beat you up. I didn't have to dig all in here. All of a sudden that now moves better. So when you're laying here, and if anybody's laying on their side, your shoulder blades should just kind of fall.
Yeah.
No matter how muscle bound you are or not. Like I've worked with some IFBB pro bodybuilders that are most muscle bound people you've ever seen, and their joints should just fall. Like your joints should just fall. Like in this position, you shouldn't have to be here because gravity's pushing down. It should be relaxed. So now if we take this same position and I bring you into extension, so now we just kind of poke around to see what feels restricted. And this one's almost like a little more over here. So same thing, just pull forward. Good. So sometimes we overcomplicate it with specific where and how, and instead of just feel and move. Pull forward. Good. Do that again. Good. Let's look at your extension again. So arms down to your side. You're just going to lift one arm up. So just like this. Just lift up in the air. Right? Just one. Just this side. Right? So and then relax. Right? I can bring you higher without the need for your shoulder blade. Mm-hmm. You still have a strength issue. It might be looser. And if I come into your shoulder blade, all of a sudden I can get you even higher. Mm-hmm. So you still have a strength issue. That's something that has to be worked on. That doesn't necessarily mean you have to pull more in that direction. That might mean this ball and socket's not being stabilized well enough in that direction. And the same thing with shoulder, like internal, external rotation stuff, which we'll work on next. We're going to be in a position here. Wrist is going to be nice and neutral. We're going to be upright like this. I don't care if your legs are here or bent. Nice and vertical here. I don't care if you hold a grip, but I don't want a death grip. So I'll just keep hand just loose, wrist is neutral. We're going to be in a position here. First thing is your upper trap loose. In this position here, when you're loaded, and this is loading directly down into the shoulder, and this is a 12, somewhere in the 25 pound range, 24 and change. Holding this is giving me this load into the back part of my shoulder. I've got to control through my shoulder blade. Obviously hold this against gravity here, but my trap should be relaxed. There should be no reason why I need to be in a shrug to be here. So first is just getting here and staying here. Staying here 30 seconds, staying here a minute. You know, I mean, if we think of time under tension, how long are you in a bench press for? Like, how long does it take start to finish?
7 to 9 seconds or so.
Yeah. So if I can be there 10x that time with some kind of load stable, that gives me way more work capacity than I need to, right? Now, granted, this is only 25 pounds, but loaded here, I should be able to do this and have a casual conversation and not be super stressed and not have my trap have to hold me up. So then if that's good, you can move to step 2. Step 2 is going to be some internal rotation and then external rotation. And we're making that be the arm. So it's almost like my elbow is driving that motion, not just my forearm. So it's like I'm trying to drive that direction, trying to drive this direction. What we're going to look at is to see first what position you get into, because when you stand up, when you get here, there's a lot of times your shoulder's just going to want to fall inward, right? And I want you to first just go 12 and 6, keep it nice and neutral. Then from there, we really have to control that external rotation and then control that internal. Internal is part of the thing that you need to get stronger on. So if I can control this internal without this thing smashing me in the face, then I own that control, and then I can start to move in that direction. So the first position this goes to is you like internal, or this thing, if you were to let this go, this thing's gonna hit you in the face, right? So I want you to try to get here. I want this wrist to try to be there, right? So this is vertical. We're thinking of a clock here, 12 o'clock, 6 o'clock. So I'm gonna let this go, don't let it turn inward. So really get this here. Good. Now take your right hand, touch your left upper trap, so you can see if it's relaxed. Is your trap relaxed? If it's not relaxed, yeah, figure out how to relax it. Get those shoulder blades down. This is that bend the bar kind of concept. You know, pulling the lats down. Get your shoulder blade down so it's not lifting up. So doing whatever you did, keep it nice and vertical. Check your trap again. Keep that 12 and 6. Trap relaxed. Okay. So then now here, let's see some rotation. Internals turning in, externals turning out. Turn as much as you can. Good. And then turn in under control. This is where me here spotting you, I don't want that hitting you in the face, but under control. So each person is different. You spend a lot of time in that position, so I'm comfortable with you being there. So that's under good control, and I'll turn it back the other way. If somebody has shoulder issues, I don't let them go into too much of that internal rotation, because you've got time under a bar that you've spent in that position a lot. If someone hasn't been there and I put them there more, I just create more of a problem.
It's tough when I feel myself shaking.
Yeah. So this is one of the things to where how much have you held in a bench press? Like let's say raw. How much raw have you?
Raw, like 415.
Yeah, it's a lot of fucking weight, right? So this is 25 pounds.
Yeah.
So this is 25 pounds in a controlled way.
Like this feels a little more comfortable.
Yeah. Well, that's where you want to live, in that kind of rounded posture. When you get external, and you get here.
Go much further than that.
So hold it there. Good. Just bring it back to the middle. Hold it right this 12 and 6. Just give me like 10 more seconds there, and then I'll take it away and bring it over to the other side. So now, we didn't test this before, but drop your arms behind you like you're doing like a floor slide. Just feel the difference, left versus right. Like the position you're in over there.
If I relax this always wants to swing out, and this one just stays.
So just that external rotation's a little better, a little more relaxed. You look more relaxed. We didn't test it before, so it's it's a moot point. But get into like a bench press position. I mean, I know you're on the floor here, but just feel how much control you have over your left side compared to your right side, just in engaging.
Yeah, I mean this one already kind of feels a little more stable because they do that.
So some of it is, in something like this, is just waking the right muscles up.
Yeah.
So it's like, obviously we need all the big muscles kicking in, but this, because it's a lighter load, might allow you to work some of the smaller ones as well. Just some shoulder stability, some shoulder position, get that wrist in a good place here, right? 12 and 6, control 12 and 6, check your trap. Just thinking 12 o'clock, 6 o'clock. Keep it there, keep it stable. For some people, that's all they need to do. Because what's going to happen is your body wants to go there. So just getting here teaches someone how to get into that lock position. So just staying there and making sure that's driven from the arm, kind of from the elbow. So 12 and 6. Then now from this position, rotate this way, which is external. Rotate as much as you can. Almost like you're trying to move that area here in the front of your elbow. Like you're trying to turn that puppy. Good. And then now turn it the other way. And then this is where you have to be safe, where if that was to let go, it's going to smash you in the face, right? So you got to keep strong, keep that wrist strong. Don't cheat me on that wrist there. Good, and now turn back the other way.
You don't want me like gripping down on it.
Correct. You don't need your grip to create this. You need your shoulder blade and arm to create this, and your grip being secondary.
That's about as far as it can go that way.
Go more. Get there. Good.
That's tough.
So then just stop at 12 and 6, right? And then now get that wrist strong. Don't cheat me with a bad wrist position. Good. Keep it there, right? I'm gonna try to move you. Don't let me move you. So stay strong. I'm gonna move you like a joystick. Don't let me move you. Good. I'm gonna try to twist you. Don't let me twist you. Good. I'm gonna try to twist you the other direction. Don't let me twist you. Good. That's that same bend in the bar kind of move. I'm gonna try to move you this way. Good. So that's just locking that shoulder blade in. Don't let me move you. Now I'm gonna give you a lot of force. Good. I'm gonna give you a lot of force the other way. Good. Back to 12 and 6. Hold it. Couple. 5, 4, 3, 2, 1. Rest. So now you could recheck that slide just out of just feeling there. I mean, there's so many other components to this that it's, but it now bench press kind of locking in. So you should feel like you have more control where everything is.
Definitely.
Yeah, so it looks better. You know, it looks easier, right? And reach behind your back on the other side. So much easier. So you're getting higher. Reach up over your head. Good. All we're looking for is for you to touch that part of the shoulder blade, which you do. You know, super red in the face. Same on this one. Good. Some of that is you do have mass there that you're running into. So that's where there is some, some soft tissue stuff there, but you should be able to reach behind your back better. So if you can reach behind your back better, then we're looking at you being able to actually get into a loaded position easier. And if that's easier and you can move those shoulder blades more, you theoretically could put more force out of there.
Yeah.
That's where the skill comes in. When you have the skill, you can use that extra range of motion. Some people who don't have that extra range of motion now have created another problem. Because now they're into a new range they can't get into. It's like people who, you fix their squat and then now they can actually, break parallel and then they're not strong down there because they've never been down there.
As I always said, if you can't touch a duffel bar in a good position, you probably shouldn't be using it.
Yeah,
Forcing you
and there's stuff too to where we accommodate stuff. Like my left shoulder's not great. I use a slingshot. My issues here for stability, it feels fantastic. And then I could just, I could bang out 20 reps with 2 1/4 just fine, and I feel great, and my muscles feel good.
Yeah.
But I'm definitely cheating, as far as using something assisting me. But I'm able to get load on the muscle in a way that I like and enjoy, which is something that I think is important. But in this thing here, without going like too far off, is if you can move and control your shoulder blades more, then you could definitely create more force. And if you could be here with a lot of force, everyone can hold a shit ton of weight here. Everybody can do that. The eccentric load, everybody's stronger that way. Especially if you have great control, you could be probably 120, 150% stronger probably. right? But here, how many people are strong off of their chest?
Not too many.
Not too many. So if you're strong and stable here, and you're strong and stable here, and you have the proper technique, well, some of that strong and stable here is literally, so, you know, go down into that posture, is literally the shoulder blades moving. It's just the shoulder blades moving. And some of it is just words. Lock the shoulder blades down, anchor them down. Well, they have to move. They can't just lock down. So if they can move on your rib cage, well, that's part of the shoulder complex. That whole glenohumeral rhythm, or the like the glenoid and the scapula, like the whole rhythm. It's the whole rhythm of it. So if it can't move, you're at a limited capacity. So part of it from a performance standpoint is that. You know, there's other stuff to where we've got to look further at the spine just to make sure you're extending better.
Yeah.
I really think it comes down to you moving your hips more. And then the one area is your ribs. To make sure your ribs are expanding well, like when you're taking a deep breath, that it's not just like an apical breath. And then the other part is that you're actually moving through your ribs well, so that as you're moving, there's a little bit of spring to them, so they're not just stiff. Because sometimes we're looking at an arch being just a rib motion. So if you get up and you're going into an arch and it's just a rib motion, and it's not shoulder blades, and it's not hips, or it's not full extension, like,
This is the boat there.
yeah, like we've literally, you know, just missed the whole entire thing.
Yeah.
And then now what's going to happen? You're going to take it off, right? And then you're going to be here, and then you're going to get here, and you're going to collapse. And you're not going to have anything to come from. Because now you're even deeper than where you were before. So when we start to get in some of that fine tuning, some of that stuff, we just need to see that unload. And that's where it's like loosen something up and then see what your technique is, what you're actually doing, and then critiquing that. Because at numbers like 700 pounds, I mean, a bar being off by an inch could probably screw you up.
A huge deal.
Yeah, so it's one of the things to where if we're talking just everyday lifting, you know, International Bench Press Day on Monday, just getting more motion is going to give you everything. But getting more motion without addressing what the other thing might be on the performance end is like a waste of time. When this area gets tight in there, that's where you could sit with a ball against the wall and then roll around, do some extra movement, you know, like work in a 3D space. So ball against the wall, lifting your arm up, lifting your arm this way, lift it back, and if the wall's here, you can't go too far back.
The tough
doing some
one
rotation,
was
going
reach
there.
across there.
Yeah, reach across.
That's when I was
yeah.
really feeling it.
So it's holding ball against the wall, 3-dimensional space, move everywhere, and then check when you're done to see if it feels better. You know, and it would be like spend 30 seconds to a minute, 2 minutes maximum on one side, like, you know, that being one side. It's like anywhere from here down and anywhere from there down. So inside part of that shoulder blade. And then I think that's a good place to start to where it's what you actually need.
Yeah. But I can't believe that I had such a hard time just with that.
Yeah.
You know?
Well, it's one of the things too of where when's the last time you ever like just held one area down and stretched it?
Yeah. Well, usually I'm so tucked under and like so much going on that I'm never just like using my shoulder. Like
Oh yeah, yeah.
I have
It's just
a very hard time with the overhead press.
well, part of it is being able to just like move the shoulder blades and that whole complex separate from everything else.
Yeah.
You know, so you should be able to extend, you know, or retract your shoulder blades and then protract them without rounding the spine and losing your belt line or moving your neck,
Yeah.
chicken-headed and shit. Like you should be able to just move those separate. Part of that is if this is super tight, they're not going to move separate. And then the issue is everyone tries to go after pec minor and pec, and all granted they're probably part of it, but like this is the, you know, like the path that nobody takes, and it's the path that gets people better faster. And I'm all about whatever's going to get people there faster, but it's also finding what you need.
Yeah.
So that's a tissue problem. Give it a tissue fix. The movement stuff is an actual wake up the muscle problem, like a motor control stability type thing. Stability being strength under load. You know, in the case of lying on your stomach, that loads gravity. In the case of bench press, that loads whatever the load you get on the bar.
Yeah. I have a hard enough time raising my hand and keeping it there.
Yeah. So it's one of the things to where
overhead shoulder work.
the more muscular control you have there, the better.
Yeah.
Starting with that position being here in this position lying on your back, first that external rotation is a coupled motion with flexion, which is overhead motion. So if you have control here, you can have control further. And then there's levels to that I'll show you when appropriate, that you can go in the sideline, you can go move to another position, we can go up and weight a little bit, you know, and then we could take that into, you know, we would take that into a position where the next place you would go is, you know, maybe we go to like a bottoms up style press in the same place. So you're in the same position, but you're in a bottoms up, and then we're doing all the same stuff from there. Or we take that same place here, and then we work kind of sideline, and we do the same stuff here in sideline. Okay. You know, just a different loaded position. Or we go bottoms up, and we go sideline that way. Or we go in standing, and we do those things. Bottoms up, flip them around. You know, all different stuff, to where once you have range, you know, we can be in a position here where we're holding it here, and then I have you walk with it, and then I have you walk with it. Yeah. Or I have you press up overhead. Yeah. You know, there's other areas, so sometimes it's go to the area that it's the hardest and then just back off. And then the second part to that would be start where you're strong and stable. And in your case with the bench press, that's actually the position you're in. So it's
walking
yeah.
around like that.
So you can maintain that range, but you're here. This is where you live. That's where your art is, right? That's where your sport is. So if we can do some loaded things in that position, it's probably better.
Yeah.
And it's at such a, like, if we think of your numbers, you're in such a high threshold number, that if we can do something on the lower end, it just makes it better. You do stuff like that, you've already got the high threshold part taken care of. If you can figure out the low threshold kind of coordination.
Last week.
Yeah, it's the same. Yeah. So do the easy shit. If you can do the easy shit, the hard shit's real easy. You already do that. It's high skill. You do the tiny things. All of a sudden, you create skill throughout the whole entire movement.
Yeah.
It's a home run. So,
Makes sense.
all right.
Appreciate it.
You're a free man.